Good afternoon, everybody. Today is March 7th, 2020, and this is your SARS-CoV-2 Coronavirus update for the day. A friend of mine recommended that I talk about this topic because there's a lot of misinformation going around right now. And basically, it's people saying, hey, this thing's just like the flu. This thing is really nothing. It's mild. It only affects the elderly, blah, 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 blah. Well, this is definitely not the flu, and believing so is extremely dangerous. I have some statistics, facts, and figures here that I'm going to go over to kind of show you what I'm talking about and hopefully answer any questions you might have. So let's get into it. So these are influenza statistics from the Center of Disease Control. This was the 2018-2009 influenza estimates. In 2018 to 2019, they estimated there were about 35.5 million cases of influenza throughout the United States. Of those 35.5 million cases, 490,561 required hospitalization, meaning they had to go into the hospital, stay in a bed, and be treated for the illness. It most likely turned into pneumonia. So 1.38% of the cases required hospitalization. Out of the 35.5 million cases, the total amount of deaths were 34,157, which is a lot, but in reality, it's only 0.096% of the illnesses or cases passed away, died. They didn't make it. So really, it's 0.1% if you round up. So 0.1% of people who contract influenza are going to die. Most cases of influenza are recovered with no medical attention required. There's over-the-counter drugs that you can get, medicines that help alleviate your symptoms so your body can fight it off through time. All right. So here are some statistics that I got from verywellhealth.com. I thought they were interesting graphics, so I figured I would borrow them. It seems that influenza is most contagious 24 hours prior to symptoms. So asymptomatic spread. You don't know the person's sick, they don't have fever, they're not coughing, sniffling, nothing. And 3 to 5 days after the symptoms start, which is typically when the person's home in bed trying to get better. That's when they're most contagious. They're less contagious 5 days after the symptoms start, which is when people begin to recover. The average time that somebody has the flu is typically, 5-7 days or so. So that is really, they're less contagious after they get better. For children though, this is interesting, 24 hours prior to, so they're asymptomatic, they can spread it without knowing that they have it, and up to 10 days after symptoms start. So I believe that is why schools have more cases of the flu and it gets spread around more, is because they feel better, but they're still sick. And they're still giving it to other people. They go back to school, and then other kids get it. And that's how it gets spread around. So here, the day-by-day symptoms of the flu. On the first day, you usually don't have any symptoms. You're not showing any. You're just feeling fine. Then days 1 to 3, you get tired, muscle aches, pain, fever, cough, sore throat, things of that nature, which just so happens to be the same symptoms of the coronavirus, right? From days 4 to 7, your fever starts to come down, you start feeling better, your cough begins improving, breathing's easier, you're less exhausted, fatigued, you're ready to rock. Let's get on with life and get back to work. So that typically takes anywhere from 4 to 7 days. All right. So this is the SARS-CoV-2, the COVID-19 coronavirus. These are the current statistics right now coming from worldometers.info. At this time, there was 104,144 cases. There were 3,526 deaths and 58,559 recoveries. So out of the currently active cases right now, the people who haven't either recovered or died, 42,059 of them, 85% are mild condition, meaning they don't have to be in the hospital. They get to go home and get better at home in isolation, quarantined for 2 weeks. But 15% are in serious or critical condition, meaning that they have to be hospitalized. They have to stay in a hospital bed, and they have to be treated, monitored, intubated, given high concentration oxygen, things of that nature. All right. So there's 6,130 people in serious or critical condition across the world right now. Out of the 62,085 closed cases, 94% recovered, 6% have died. Now, that I don't believe that's an accurate number, because I don't believe any of these numbers are really accurate. I mean, if you don't test for them, you don't really have any cases, and if people don't go to the hospital because they don't feel the need to, and they just recover at home, then they don't count. Also, if the hospital doesn't have any room and turns people away, then those people aren't going to be counted either. So as far as the incubation period goes, the incubation period is anywhere from 2 to 14 days, but there have been studies that have shown that it could possibly be longer, up to 27, 28 days even. So here, there was a case, somebody in Hubei province in China, 27 days. Same here, published on February 21. 5 studies from the JAMA study, the JAMA. They got 15 days was observed through 5 cases when they studied 5 cases. So the outliers are there. I don't think that the 14-day quarantine is long enough, and we have seen cases where people have left quarantine and then tested positive after the fact. So that's not good for containing this. It's really, really, really bad. Right here, estimating, you're looking at about 5 days that the average is for people to start showing symptoms once they are infected with this virus. So what I did here was I looked at SARS-CoV-2 and influenza. I kept the numbers the same just so I could compare them based off the 2018 numbers and 2019 numbers from the CDC, and basically this was the influenza numbers. So I did the same thing here. And I did the math. It's really easy. You can do it yourself. So 1.38% of illnesses for influenza have to be hospitalized. 15% of illnesses require hospitalization, intubation, or concentrated oxygen with the coronavirus. So you're looking, if the same amount of people got infected with the flu as with the coronavirus as they did the flu, you're looking at 5,328,132 people would need to be hospitalized. That is way, way higher than this amount here. It's 10 times the amount, right? This is not good. This is really, really, really bad. The original estimate for the death rate was about 2%. So that would have been about 710,000. But the World Health Organization just upgraded it. They said that they believe the current death ratio right now, they're estimating it's going to be, I should say, case fatality rate, how many people die or recover, they're estimating 3.4%. So based on this new estimate, we're looking at 1.2 million people passing away from this disease. Currently, at the 6% number, we'd be looking at 2.1 million people getting it. 2.1 million people, 34,000. 1.1 million people, 34,000. Completely different. The incubation periods are completely different too. You're looking 1 to 4 days for influenza. You're looking 2 to 28 days. Average length of illness, 5 to 7 days. You're looking at an average length of illness of 14 to 21 days here, depending on how severe it is. So here's the problem. If the incubation period is 28 days, they start showing symptoms. They have all the same symptoms as influenza. They're going to think they have influenza. They're not going to go to the doctor until they think they're dying. That's just human nature. So if they're waiting 5 to 7 days and then they don't get better on 8th, 9th, 10th days, then a light bulb pops off. Hey, you know what? Maybe I have this coronavirus thing that everybody's talking about. So then they go to the hospital. So you're looking at 38 days since they were infected before they go to the hospital. Now they go into the hospital. They have to be hospitalized. They go into they lay down in the hospital bed, and it takes another 14 to 21 days from hospitalization until they're better. So you're looking at about 2 months time from when they're originally infected until they recover or die. We've only been aware of this thing for 2 months. So we're just now seeing the final data of the original illnesses and the secondary generation and the third generation. Who knows what the actual numbers are going to look like on this thing. But as you can see, it's completely different. And looking at this and saying, oh, it's just the flu, it's just mild, it only affects old people, none of that matters. Because 15% is 15%. I don't care if they're young, old, middle-aged, whatever. 15% is 15%. And the biggest problem, right here, why is this such a big deal? King County, Washington. That's where the main outbreak is going on right now in the United States. The population is 2.18 million people. 2,180,000 people. Right now, there are scientists who are claiming that anywhere from 40 to 70% of the world's population could become infected with this virus within the next year. I don't have the source, all right? There's tons of articles, just Google it if you don't believe it. But what I did is I took 50% of the population, just average it 50%. If 50% of them get it, that's about 1.09 million people. So the percentage of hospitalizations going off of that 15% that we're seeing right now, we would need 163,500 patients requiring hospitalization. The number of hospital beds in King County, Washington is 11,773. That's the total amount of available hospital beds in King County, Washington. They would need 163,500. They only have 11,773. What's going to happen to all the other people that need to be hospitalized when the hospitals run out of room? That's the problem. That's why it's such a big deal. The virus isn't the biggest risk. Overloaded hospitals are. If the hospitals become overrun, patients won't be able to be treated. If the amount of infections become too numerous too quickly, the United States healthcare system will fail. As reported in China, infected individuals will be turned away and sent back home. People were overloading the hospitals. They're going into these hospitals in China, and they just didn't have the room. They were turned away. They never got tested. They were sent home to die. Many people here could potentially die in their homes due to lack of care. And regular ailments won't be able to be treated. Heart attack, stroke, car accidents, cancer, childbirth, all of these different things that happen on a day-to-day basis won't be able to be taken care of because the hospitals will be swamped with very sick, very contagious, dying people who have pneumonia, basically. These reasons are why the world governments have taken this so seriously. They've done massive quarantines, they've canceled events, there's travel restrictions, travel bans, all of these things are unprecedented. Unprecedented. There is a reason why they're treating it so seriously, is because it is very serious. And the government's goal is to keep order and discipline, maintain control, and prevent panic. I am a firm believer, don't listen to what they say, watch what they are doing instead. You need to pay attention and be able to read between the lines. And you can do your part. This disease won't be the end of the world, but we can help by doing our part, all right? What you need to do is you need to prepare you and your family for isolation and social distancing. Either it be voluntary or mandatory. And I'll tell you, the CDC, the United States government is already telling people that there's going to be social distancing, that there's going to be disruptions in their day-to-day lives. They're already telling people to prepare, so if you haven't yet, you should definitely do it now before it's too late. There's already panic buying. You need to go out and you need to take care of you and your family. You need to stock up on 3 months worth of supplies, food, water, medicine, toilet paper, supplements. If you're sick, you need to stay at home. And if you have the ability to work from home, you need to do it immediately. You need to limit your exposure to public. Don't go out to events or crowded places. Don't go out to eat. Stay home. Do not travel. Do not take buses, trains, boats, or airplanes. You need to stay away from people and stay away from confined places that have a lot of people in it. If you need to go anywhere, drive yourself or have somebody drive you. And please, take your children out of school immediately. We're already seeing school closures in the United States because of this thing. I'm estimating very soon, over the next few weeks, that most, if not all, of the schools in the United States are going to be closed because of this pandemic. If that's the case, nobody's going to care that you took your kids out of school now. They're not going to blame you. There aren't going to be any repercussions. There's not going to be anything that's going to happen. Your children, I'm not worried about the children. Your children will get sick. They'll bring it home, give it to you. They might not die, but you may. And we don't need to see a bunch of kids orphaned because their parents didn't take them out of school. If we do all of these things, we can make it through this together. Conclusions from this is not the flu. Dismissing SARS-CoV-2 by saying it's not that bad, it's mild, it only affects the elderly, or you just need to wash your hands. It's extremely dangerous. This thing is highly contagious, highly infectious, and very, very deadly. It is way worse than the flu, and people need to start understanding that, because right now they're ignoring it because the media and government are telling them that it's not bad. They're trying to keep people from panicking. You need to prepare yourself and your family for what is inevitable. You need to prepare for social distancing and isolation. Stay away from crowds, events, coffee shops, restaurants. You need to stay away from all of this stuff. And you need to wash your hands regularly and try to prevent yourself from touching your face. If you think that you have a fever, dry cough, sore throat, you believe that you may have this virus, do not go to the hospital. I'm going to repeat that. Do not go to the hospital. You need to call them first, and what they'll do is they'll give you proper instructions on what you need to do. Go into the hospital without notice, you're going to go into that emergency room, and you're going to expose the healthcare workers and all of the people that are in there to this disease unnecessarily. If you think you have it, don't go. Call them, and they will tell you what to do. Well, that's it. I hope that this answered some questions. If you have any questions, you can comment below. But other than that, good luck out there. This was your SARS-CoV-2 coronavirus update for the day. I appreciate you.